Thank you, sir, and good afternoon, everyone. So we'll get started. Yeah. So I'm Dr. Rahul Baxi. I am from Bombay Hospital and Medical Research Center, Mumbai. So does gut rule influence of microbiome on diabetes and obesity? So the agenda for today: decoding obesity, mind-gut connection, altered microbiota and obesity, and then I will conclude with a few points. Prevalence of obesity, we all know it's rising at an alarming rate, and 650 million people live with obesity. 41% of them are women, and 31% of them have obesity. Obesity is a complex and multifactorial disease. It's an imbalance between energy intake and energy expenditure. There are hedonic inputs, which is increasing palatability and pleasure. Environmental inputs, which include inactive lifestyle, smoking cessation, and psychological factors. And then other factors like adipose tissue, pancreas plays a role, gut, genetics, and medications. Many paths lead to obesity. It's a complex interplay of several factors. Obesity is not simply due to an individual's choice or lack of willpower. This is important for us to understand. Many times we tend to blame the patients, that you're not following diet, you're not following it. It's more than that. So, some patients will think, sir, मुझे तो thyroid है, इसलिए obesity, इसलिए वजन कम नहीं होता. So, there are a lot of factors which we need to consider. And appetite is normally regulated by a complex interplay between gut and brain. Mind gut connection. Let's see what this is. So the body weight is regulated by a physiological processes along with the integrated gastrointestinal response to food intake, and the gut microbiota influences nutrient acquisition and energy regulation, potentially contributing to obesity. And therefore, it's important to further understand the contributing factors and pathways of altered gut microbes that lead to obesity. Understanding the role of brain. So, homeostatic eating. What is this? This is eating for hunger. So, controlled by the endocrine feedback signals, the brain controls eating behavior and appetite. Weight is determined and regulated by a unique three-layer appetite system. And there are some GLP-1 and peptide YY, OXM, pancreatic polypeptide, amylin, insulin, and leptin, which increase satiety. And there is ghrelin, which increases hunger. Then there's hedonic eating, eating for pleasure. You're not hungry, but you just want to eat. Example is we've had a dinner and that at night we sit down, open Swiggy or Zomato and order some ice cream or kulfi or faluda. This is happening a lot, especially with the younger population. And that's one of the reasons, especially during COVID and all with these online apps, a lot of young patients we all are seeing in our practice. So that's one of the points which contributes to that apart from lack of activity or exercise. It's controlled by the brain's reward system, and dopamine controls wanting, the motivation, drive to eat, and opioid and cannabinoid receptors control liking, the pleasure associated with food. And then there is executive function, which is deciding to eat, which is a behavioral therapy. So self-regulatory process influencing eating. And so there are thoughts, behavioral interventions empower sustainable behaviors in controlling eating. So thoughts, behavior, and understanding the role of the gut microbiome. So these are the enterocytes, so including the absorptive enterocytes, which form the 90 to 75%, enteroendocrine cells, goblet cells, Paneth cells, stem cells, myofibroblasts, and immune cells. So this is the definition. This is important. What is the gut microbiome? As defined by Lederberg, it is the totality of microorganisms, bacteria, viruses, protozoa, and fungi, and their collective genetic material present in the gastrointestinal tract. So now looking at altered microbiota and obesity. So altered gut microbiome composition in people with obesity. So altered composition, altered fermentation, and increased energy harvest. So microbiota in normal gut includes Firmicutes phylum, Bacteroids phylum, Actinobacteria phylum, Verrucobacteria phylum, and FP species. And microbiota in obesity. So what happens to these in obesity? So there's increase in the Firmicutes phylum, reduced abundance of bacteroids, a higher level of Actinobacteria phylum, lower level of Verrucomicrobia, and reduced abundance of FP species. And relative decrease in the abundance of bacteroids, together with a relative increase in the Firmicutes, characteristics of obesogenic microbiota. And fatty diets shift microbiota compositional pattern in favor of obesity. So this is the shift which happens, and we'll see in the further slides how does this happen. So mechanisms behind altered gut microbiota in obesity: increase in short chain fatty acids, increased lipogenesis, increase in fasting induced adipocyte factors, increase in lipoprotein lipase, and increase in gut endocannabinoid systems, which leads to increase in gut permeability and increase in lipopolysaccharides. Exploring factors impacting gut microbiota, role of genomic and epigenomic stability. So microbiota dysbiosis. So there is eubiosis and there is dysbiosis. So these are some of the important points, including high use of artificial sweeteners. We are having tea outside. There are three options kept: white sugar, brown sugar, and then there is this sugar substitute. So high use of that. A lot of patients say, "Sir, I use sugar free," but even the quantity is important because that can alter the gut microbiota. High fat, high sugars in diet. I don't need to tell what we all had in the lunch. Sleep disturbances, chronic antibiotic treatment is another important point which we need to consider, which can alter the gut microbiota. Indiscriminate use of antibiotics does happen at some places and in all parts of our country. Stress, host genetics. Then microbial derived metabolites, including epigenetic modifications, high production of short chain fatty acids, and increase in gut permeability. All these lead to obesity, dyslipidemia, inflammation, insulin resistance, and fatty liver. Role of high fat diet. So on this side you see is the normal diet where there is transcellular and paracellular movement, whereas on the right side you see is the high fat diet. High fat diets can lead to a leaky gut, resulting in increased permeability and inflammation. So there are disruption of tight junctions, and then there is this leaky gut, which can later on lead to fatty liver, metabolic syndrome, liver fibrosis, atherosclerosis, and obesity. And in the normal side, if you look at normal liver and blood pressure, so their gut bacteria and antigens are present. Role of lifestyle factors. So breastfeeding, it starts in fact, at birth also. How does so when the fetus is in the uterus, there are no microbiomes there. As soon as delivery happens, whether it's by cesarean or by normal vaginal delivery, that is when the first contact of microbiome happens with the fetus, when it is born. And then breastfeeding or, formula feeding. So breastfeeding is protective, of course. We all know this since many, many years. And formula feeding, because both of them give rise to different types of microbiota in the gut. And the breastfeeding gives protective microbiota. Formula feeding does not give protective microbiota in that sense. And nowadays we've been reading a lot about, the different types of formula available in India and Asia compared to the European counterparts. There have been some controversies on that. So that again is important, high sugar content and so on. So all that leads to sows the seeds of obesity and diabetes in the future. Antibiotic use, we have discussed, increased risk of obesity. And sleep disturbance, again, very important, very underrated, I feel. Stress and sleep, we all treat diabetes and obesity. We talk about drugs, we talk about diet, we talk about exercise. Generally speaking, also, we must address sleep and stress for all our patients because, that is part of lifestyle and a very, very important factor to achieve good control of these factors. Having concluded the significant impact of brain-gut relationship on obesity and the identified influential factors affecting gut microbiota, it is imperative to note the existential evidential studies that validate the aforementioned relationship. Gut microbiota and metabolic health among overweight and obese individuals. Aim is to investigate association between gut microbial composition over obese subjects. Metabolically healthy group, which is MH 317 without any metabolic syndrome components, and metabolically unhealthy group, which is MU, with at least one metabolic abnormality. So what they found here is Fusobacteria was more abundant in the metabolically unhealthy group. So these are the different types of microbiota, and Oscillospira negatively associated with metabolic and unhealthy group. And MU group had lower abundance and of Odoribacteriaceae, Christianisolaceae, and Coriobacteriaceae families. Metabolic health was associated with gut microbiota composition, and there was significant difference in the composition of gut microbiota between the two groups of this study. So altered microbiota, which is dysbiosis, has been positively correlated with various diseases. So cardiovascular disease, atherosclerosis, Parkinson's, hypothyroidism, sarcopenia, rheumatoid, inflammatory bowel diseases, and of course what we are discussing today is obesity and type 2 diabetes. This was mentioned to be 15 minutes. The timer was of 10 minutes probably. So I'll just continue. Dysbiosis is a pathogenic genetic component of metabolic diseases. So unhealthy diet leads to perturbed nutrient handling, insulin resistance, and altered microbiota composition. And we were talking about leaky channels here, which leads to systemic inflammation and lipid metabolism, affecting the pancreas, liver, kidney, and vascular. So excessive high calorie foods. leads to microbiota changes, gut immune imbalance, impaired cell connections, leaky gut, dysmetabolism, translocation of bacterial products, low-grade inflammation and transcription inhibition of insulin sensitivity, which leads finally to insulin resistance, dyslipidemia, and islet cell damage. So this was a very interesting image here. So gram-negative bacilli, along with the diet, what the youth is having, increase in lipopolysaccharides and reduction in butyrate, which leads to insulin resistance, increase in intestinal permeability with inflammation. Dysbiosis and obesity biomarkers. So zonulin is a protein that regulates insulin permeability. Biomarkers for assessment of intestinal permeability in clinical practice. So 3% had increased intestinal permeability. This was based on the BMI, if you see. So data indicates a potential association between body weight and intestinal permeability. So fecal zonulin in normal BMI or no BMI, it was not that high. In overweight to obese, fecal zonulin was positive, and in morbidly obese also fecal zonulin was positive. So amounts of fecal zonulin seem to be increased in parallel with the BMI, being lowest in normal weight individuals and highest in individuals with obesity. So now, gut microbiota functions, I'll just move on to this. It's involved in production of secondary bile acids, protein catabolism, degradation of xenobiotics, production of water-soluble vitamins, and it can lead to control of inflammation and immune response. And factors affecting gut microbiota, it can be modulated by different interventions. So these can be potential treatment for diabetes in the future. So such as prebiotics, probiotics, fecal microbial transplantation, intermittent fasting, all of which are considered as potential therapeutics for type 2 diabetes. So this also we'll escape. So gut microbiota, diabetes and chronic complications. So this depicts chronic micro and microvascular complication of diabetes associated with changes in the composition of gut microbiota. And in this one depicts potential effect of restoring gut microbiota eubiosis in ameliorating, preventing or delaying the onset of chronic complications of diabetes. So future possibilities, personalized nutrition and probiotic use, synergistic approach in diets, probiotics and microbiota, targeted colonic delivery of short chain fatty acids, pasteurized products, genetically modified bacteria, and fecal microbiota transplantation. So concluding, obesity epidemic is a public health crisis. Microorganisms present in gut are capable of directly or indirectly influencing the gut-brain axis, which can result in changes in energy homeostasis. Dysfunction in gut permeability contributes to early onset of inflammation. Fecal zonulin as a biomarker, as we have seen, can increase according to the BMI. And a strategy including fecal microbial transplantation, medications, prebiotics, probiotics, functional food, and intermittent fasting has been suggested as strategies to reduce type 2 diabetes, and identifying specific causally related microbial taxonomy or microbial metabolites responsible for pathogens of type 2 diabetes could provide interesting new opportunities for diagnosis, treatment, and prevention of type 2 diabetes. Thank you.